Hello, welcome to Maternity Nursing 1 with me, Miss Kenan. Today I'm going to present the slides of Intranatal Care by Ibu Eva Bertitali Tondok, PhD. The learning objectives for today is to know the four periods of birthing process of what we call kala 1 sampai 4, then to understand the signs and symptoms of labor in the first stage, and then understand the physiological adaptations that occur in stage 1 to stage 4. Now, this is the stage of labor. So we all know that there are four stages of labor. The first stage is about the dilatation. So we have three different process in the dilatation. Start with the latent phase, and then active phase, and then transition phase. So the latent phase is when the cervix is opening from the 1 to 3 centimeters, happening every 2 hours. And then the active phase is when your cervix is opening 4 to 7 centimeters every 1 hour. Then we move to transition phase where the cervix is open around 8 to 10 centimeters, which happens every 30 minutes. Now we move on to the second stage of labor, which where the baby is being born, and with the um, cardinal mechanism where the baby has to turn into the 7 movement, and then will be delivered vaginally. Then we move to the third stage where the placenta will be delivered, and then we will be able to observe the shiny fetal membrane we call the shield C, and then we also be able to see the dirty maternal surface, which we call the Duncan site. And then we move on to the fourth stage where it is 1 to 2 hours after delivering the baby or after birth, where the normal blood loss will occur around 300 to 500 milliliters. So in the first kala or first stage, kala 1, this is actually the signs of labor, where the woman actually will experience slight signs or that will signal the onset of labor. So we need to taught every woman to recognize the sign of labor. Which are the signs of labor? The signs of labor are the uterine contractions that happen steady with the very short pause between one contractions to the other contractions. Then we have the bloody show where the woman will have a little of blood coming out, which is not hemorrhage or not bleeding, but it's just like a little mixing with like the vaginal secretion. And then we will also have the ruptures of the membrane where we then have the amniotic fluid come out. So that's the true signs of labor. As the woman is moving on to the kala 1 or the stage 1 of labor, the woman will have experience a lot of contraction, and we will encourage the woman to keep moving, to also then have a position that really comfortable for her to continue the openings of the cervix until it's fully dilated. So we can encourage mother to sit with the right leg open on the chair and then bend over the table. We can also ask the mother to do this dog position where the four ends is on the bed. And then we also can emphasize the mother to do the squatting positions, which will then relaxing the cervix bone and then the cervical bone. And then we also ask the mother to probably just lie down on the bed and then squat while pulling the legs up towards the chest so that it will open the pelvic bone. Now we move on to Kala 2, where the baby is being born. So as a nurse, we will prepare the sterile instrument that will be used during the birth. This can be the drape and also a scissor or needle and a shooter set. And then we assist the mother when the mother is going to push out the baby once the dilatation is fully open. Then we ask the mother and assist her in how to push in each contractions. We also can teach the mother on the breathing technique as well as pain management during the delivery of the baby. And then we can also emphasize the father to be together with the mother during the process of delivery to increase the bonding between the father and the mother as well as between the father and the baby. We can also ask the father to actively participate in clamping of the umbilical cord. So we ask the father, teach the father on how to assist on certain medical procedures that is safe for the partner to take part in the birth. And then after the baby is being born, especially when the head is out from the cervix, the pediatrician, all the physicians can then start to cleaning the nose and mouth, can also start to do the suction for the nose and mouth so that this will hinder the baby from breathing the secretion when the baby is taking the first breath. Next, the responses to labor from the mother and from the field. It will be related to cardiovascular system. Will the cardiac input will be increases because the blood circulation will also increases, and then the uterus will then decrease. But then the general and peripheral circulation will increase, and then also the blood pressure of the mother will have a slightly increase around 15 millimeter. Hg, and this is where the systolic and diastolic will then show a little bit rise. Then we move to Kala Tiga or Kala 3, where we learn about the delivery of the placenta. So at this stage, after the baby is being delivered, baby can straightly be put into mother's chest to initiate early breastfeeding and also to increase the bonding between the mother and the baby. But then meanwhile we are doing that, we also waiting for the birth of placenta. Remember, we cannot pull out the placenta, so we need to wait for the contractions and ask the mother to really push the placenta out. Once the placenta is out, we have to watch if the placenta is being delivered wholly, without any left part behind, and we have to watch on the bleeding as well that happen after the placenta is being delivered. Remember that we did not pull the placenta out, so we just wait until the mother is like delivering the placenta from the birth canal. And after the baby and the placenta is being born, we move on to the color 4. So this is the observations after the baby and placenta being born. It's happened 1 to 2 hours after um, delivery. So here we need to assess the psychological responses of the woman to the labor. Sometimes the woman will be very fatigued, having a lot of fears, and sometimes the cultural values and belief also can influence the mother during the process of after delivery or postpartum. In our case today we have Sherry. This patient is delivering her second born child, and then she has an older child before, so she needs to spend time before delivering the other child for her. And in the homeopathic system, there will be stress and heavy exertion that's going on, then this will increase the leukocytosis development, which will then increase the circulating white blood cell within the mother's body. By the end of the labor, when we do the blood check, their leukocytosis level, leukocyte level will be then around 25,000 to 30,000. And in the respiratory system, there will be increase in the CV parameter, as well as increase in the respiratory rate, and also sometimes mother experience the hyperventilation, so we need to supply for additional oxygen. At the same time, we also need to check the temperature regulations, which will increase because of the muscular activity that is going on during the delivering of the baby, and there will be a slight elevations of 1 degree Celsius for the mother body temperature. Mom also experience diaphoresis, as well as we need to use the system of evaporation to really cool the mother, and also have the limit warning to the mother temperature regulation. As well as regarding the fluid balance, there will be also increase in the rate and the depth of respiration that will cause the mother to have diaphoresis. There will be an increase in insensible water loss, as well as when needed, we need to supplement intravenous fluid replacement therapy when it's necessary. So we can also have the IV standby, IV cannula standby. So in case in the process of delivery, the mother fall into emergency cases, we already have the fluid access ready to do the resuscitations for the fluid. Now we're going to see once the baby is birthed, as being birthed, then the nurse then will count the apical pulse and observe the baby if it's a pink color, where there's the needed of administrations of oxygen, and also we can ask the father to join in to observe the baby from the nose, mouth, as well as the doing identification procedures to do the footprint. Then we can also ask the father to witness the weight and the height of the baby, the measures of length. And then we can also emphasize that the father that continue on to be there to support the mother as well as to create bonding with the newborn baby. So in the urinary system, sometimes after delivery, the decreased fruit intake is real in the mother. So there will be also increase of inaccessible water loss. So we need to encourage mother to keep drinking water, so there will be no dehydration. At the same time, when the fluid intake is also decreases, the kidney begin to concentrate the urine to preserve the both fluid and electrolyte within the mother's body. And also because the mother has been through a lot of muscle activity for the delivery of the baby, which increases during the contractions and the cardinal mechanism, the body will then also do the breakdown of protein to make sure that the mother get enough energy. And we, as nurses, we also needs to make sure that the mother will then void regularly every 2 hours to make sure that all the system in her body is functioning well, to remove all the fluid excess and to maintain the food and electrolyte levels within her body. Now, in the musculoskeletal system, we have what we call hormone relaxin. So this hormone works to soften the cartilage between the bones. So the symphysis pubic and the sacral necrosis joints are relaxed and easily to be moved, and this will allow stretching up to 2 centimeters, so that this will make the baby pass through the birth canal and pelvic bone very easily. Now, in the GI system, there will be a shunting of blood more to the life-sustaining organs, and also the pressure on the stomach and the intestine from the contractions of the uterus. And this will cause neurological and sensory responses. But then, as the uterine is contracting and also the cervix is dilating, this will cause discomfort on the uterine and cervical nerve plexuses T11 and T12, and in the perineum at sacral S2 and S4, 2S4. Now, once the baby is being born, mother is being relaxed, and then we observe is there any bleeding or hemorrhage, then we ask the father to introduce the newborn baby to the siblings. So we hope that this bonding between brother and baby and the father can happen very quickly. As a nurse, we also assist the mother to see and ask to know how is her labor for her, what is the good thing, how is this labor becoming any traumatic event for her, or what does she needs now as support from the nurse and midwife. At the same time, we also perform assessment on the mother, so we assess the fundus of the mother in the first hour of the after the birth to see whether the fundal is really contracted and coming back to the normal size before the pregnancy happened. Now, once the mother is starting to initiate breastfeeding, we can encourage the grandmother and also the siblings or the brother to come and see, so that they will also provide support system for the baby and the mother during the process of breastfeeding. Now, once the mother is healthier, once she regained her strength, nurses can then teach mother how to take care of the mothers, how to take care of himself, how to take care of her body, what to do, how to make her happy, and then how to take care of the baby as well. At this moment, we are watching how we educate how to take care of the umbilical cord. When the baby is also a male, we can also do circumcision to the baby, and then we also can teach the mother how to do circumcision care so that the mother can take care of the baby when the baby and mother are at home. So what we do, basically the nurse will demonstrate the procedure, either the umbilical cord care or the circumcision care to the mother, and then the mother will do a return demonstration so we can be sure that mother is able to take care of the baby when she is at home with the baby. After all the education and teaching is done, then we can roll the mother out of the hospital. She can go home and start to take care of baby at home. And we emphasize that there is a necessary visit a week after delivery to check on the mother as well as to check on the baby. So yeah, that's how we take care of the baby. Thank you for your attention.